Today I have one new case of Covid-19 to report in New Zealand. This person is a man in his 60s and he is in one of our facilities in in Auckland, in our quarantine facility, which is the Jet Park Hotel. So this man flew from Lahore in Pakistan to Doha, and then from Doha to Melbourne on June 11, and then he flew from Melbourne to Auckland on flight NZ124 on the 13th of June. So again, this is a case at the border. We will continue to get cases at the border. As you're aware, there is still a pandemic raging off our shores, and in fact the number of daily cases continues to be at a very high number around the globe. So this case, this person flew in on June the 13th. He wore a mask on all the flights he was on, and we're in the process, or our team is in the process of just contacting all passengers on that Air New Zealand flight, and we've also alerted our overseas counterparts regarding the other flights. And of course, those people coming in on that flight from Australia will be in managed isolation facilities in Auckland as well. Now, the man, when he arrived, was not symptomatic or considered to be symptomatic, and he was checked into one of the managed isolation facilities in Auckland, the Nomi Hotel. On the 15th of June, a few days ago, he developed some symptoms, and he was transferred, as happens with anyone who develops any symptoms during their 14-day quarantine period. He was transferred to our dedicated quarantine facility in a van, and of course those involved are wearing full PPE. The man's travelling companion, who's considered a close contact, was also transferred with him to the Jet Park Hotel. He was swabbed on the 16th of June, and the positive test result was returned last evening, and so is included in our reporting today. There are currently 145 people staying at the Jet Park facility. Anyone who comes in through the border with symptoms is taken there and treated as if they have Covid-19, and they remain there. They have a test, and anyone who develops symptoms during their time in one of the other managed isolation facilities is taken to the Jet Park if they develop symptoms, and there are very strict protocols in place there. Just moving on to the two women who we talked about on Tuesday who drove from Auckland to Wellington. And as I clarified last night in a statement and then in interviews this morning, I was alerted late yesterday afternoon to new information that they had had some limited physical contact with two friends after getting lost trying to leave Auckland. And those two friends, upon hearing the news that these women had tested positive, then isolated themselves and have been tested. One of them has returned a negative test, and the other one, the result is pending. There is ongoing work by our National Contact Tracing Centre to follow up all possible contacts of the two women, and the number has actually expanded because we have now included all hotel workers. There are further people who have worked at the hotel facility. So there were 364 people at the managed isolation hotel, the Novotel in Ellerslie. That includes staff, passengers on the flight, others who were at that facility or had been at it since the 7th of June, and other immediate contacts. 90% of them have already been contacted, and just 27 are still in the process of being contacted. All those in the hotel still were tested over the last day and a half, and those test results are coming through mostly today. So I just want to reiterate the comments I made this morning in my interviews that, clearly the ministry team and the staff, many people from across the public sector who have been working at the facilities in Auckland have been doing so for months and very, very committed to ensuring that we keep New Zealand's border safe. There was a lapse in the process for us introducing the routine day 3 and day 12 testing over the latter part of last week. And I know that the case of these two women will have upset people and shaken people's confidence. I've certainly been upset by it, and I apologise that we've ended up in this position. As I said this morning, and I want to reiterate, I've taken responsibility to make sure that the system is sorted, and we're getting on and doing that. And what I can assure people is that since I found out about it on Tuesday, as I've said, I've instructed that no one's to leave any of the managed isolation facilities unless they've had a negative test, whatever the reason. And that day 3 and day 12 testing is gearing up and in full swing. And yesterday, around 600 tests were done across the hotels as part of that. That's in addition to the testing done of the contacts there. So then just to finish off with our confirmed numbers, obviously have increased by 1, so our confirmed case number is now 1,157. We will report the additional case through to the World Health Organisation, and our total number of confirmed and probable cases is 1,507. I'm pleased to say there are no additional deaths to report, and the 2 women who are cases here and the person in Auckland do not require hospital level care and are being cared for where they are. Today, another significant cluster, which was associated with an aged residential care facility in Hamilton, has closed, and there are just 3 clusters that remain open until we've had that full 28-day period since the last person finished their isolation period. Yesterday, our labs processed 4,936 tests, and the total tests completed to date is now 321,187. Open to questions.
Why didn't the Public Health Unit tell you when they first learnt that the women had tested positive? Why didn't they tell you that?
Yes, so as part of follow-up, the Public Health Units routinely do follow-up interviews, in fact have quite a lot of contacts, because especially in a situation where someone's distressed, these women had recently lost a parent, and of course there's a lot of scrutiny on these cases. The follow-up interview on Tuesday evening, they volunteered the information that about getting out of Auckland they'd got lost. Neither of them recalled, nor still recall, the fact that there was brief physical contact with one of those 2 people. And so when the Public Health Unit did their assessment on the Tuesday evening of that information, they didn't even feel that these people were really, they may be casual contacts. The information wasn't passed on. As soon as I found out about it, which was yesterday afternoon, I rang and spoke with the Medical Officer of Health, and I asked her to have a follow-up conversation just to verify all the details, and that's what they did, and that's when I released that update last evening.
Why do you treat what they said as fact? Because all of your statements said they hadn't had any contacts with anybody. That was just based on what they've said, and it was erroneous, as it turns out. But why were you treating that as fact rather than this is what they've said? Because it's a trust-based system.
Yes, so a couple of comments there. And the first comment here is, of course, it's really important for contact tracing and effectively managing any risk to the community that we get full information. And as I've said, and the Medical Officer of Health involved here is one of our most experienced ones in the country, this is very common, and this is why they do the follow-up interviews, because it does elicit additional information that people may not have recalled or they may not have thought was important. I provided all the information I had on Tuesday when I made the announcement. As soon as it became clear what the other information was, and I was privy to that. I released that in a further statement last evening.
Did you trust anything that you say?
Well, I hope that people will trust what I say, because we've spent the last few months, right from my very first stand-up, being open about and communicating with the public about what was happening. And every day, everyone got the same information at the same time about the cases. And of course, in this situation, yes, the information has evolved. I haven't kept that to myself. I have shared it.
You stated as fact what these women were telling you. It was wrong. So why should we trust anything that you say?
Because on Tuesday, that was the full extent of the information I had, and the action that was being taken was based on that information. Now that we have further information, I have both shared that and also asked that that information was acted on.